Let the pediatricians understand that every baby should be availed of newborn screening because it's preventative, and the diseases that it prevents are those that cause mental retardation and death. And so the incidence of these diseases are now being determined in India on a pilot basis so that we can see which disorders are the best ones to screen for. And there are pilots implementing the laboratory work, the follow-up work, education of the physicians, education of the parents. And so physicians need to be aware that these diseases can be picked up at birth by this test, a simple blood test from the heel of the newborn, before symptoms occur. This is critical because the baby will look normal, but the biochemical testing will show that there's an abnormality which will manifest itself later. So if it can be detected early, treated early, then death and mental retardation can be prevented.
Well, one, the pediatricians will have to take the lead position in making sure that the babies, the newborns, are actually screened at birth. Since they take care of the babies at birth, they have the primary responsibility of making sure it is done. So that's the first. Second is bringing this matter to the level of the ministry. The pediatricians, since they take care of the patients, can tell the ministry that these patients do exist in India and we must do something about it. So the third is the pediatricians will be in charge of educating the other doctors, the nurses, the midwives, the parents. If you look at that, the pediatrician is always at the center, whether it's diagnosis or treatment, or talking to the patient, or talking to the other health professionals. You still have the pediatrician who is in charge of the baby as a very important person in the whole team.
The conditions are relatively rare, and many of the times the pediatrician may not be aware of exactly what the condition is. That's obstacle number one. They got to educate themselves. There are plenty of things online. The American College of Medical Genetics has action sheets available online that tell the pediatrician what the disease is, what the next step is once they've found a positive result, who to refer to, what type of specialty to refer to, and actually gives an idea of the mechanisms that the referral will take. So that's number one. They have to be aware of educate themselves. Then they're going to have to be aware that the parents will not understand what's going on, and they have to put it in parents' language. And that's a big challenge. But once they understand themselves, it's easier to overcome that challenge. Government support is another thing that's not been too available, and so the physicians need to understand that they can drive the government by requesting these tests, doing them themselves, showing the positivity of the findings.
I think the delegates realize that they have the cases here in India, and that developing countries around the world are going through the same experience of finding a way to make it happen in their own countries. So being a developing country should not exempt us from not doing it or from doing it. So both developed and developing countries should push for newborn screening, because a family with a child affected by one of the conditions cannot afford to pay for the care of a retarded child. So through newborn screening, we can actually avoid the complications.
So I think the key takeaway from here is that rare diseases are important. Even though there may be few cases, that one case is the one case to those parents and that family. So rare diseases are important. Newborn screening is important because it detects diseases that can be catastrophic at birth. And just with the simple collection and diagnosis and treatment, that baby can lead a normal life.